Imagine being told that your unborn baby has a heart defect so severe that it can result in it either dying in the womb or being born with a hole in its heart. If the hole is too large, the prognosis can be grim. Traditionally, the only way to repair such a defect would be with a surgery to physically sew the hole shut. But what if science discovered something new? A completely natural peptide that could prevent the need for a risky heart surgery or the baby dying in the womb. Normally, this would be considered almost physically impossible. The medical community has long accepted that the heart has very limited regeneration potential, except under some exceptional circumstances. But this is the reality of Emily's story, and how a small peptide she took while pregnant was able to completely heal the hole in her baby's heart and lead it to be born with a healthy heart and no longer require any surgery. These are the type of results we are getting with our molecular bioenhancement coaching programs, by the way. But before I get into that, I just want to cover the type of heart defect that her baby had. This is known as a ventricular septal defect. This occurs when there is a hole in the septum which separates the two lower chambers of the heart, known as the right ventricle and the left ventricle. So normally during the systole, which is the phase of your heartbeat, you have blood that gets pumped out of the left ventricle into the aorta, and how much blood that's pumped out is known as the left ventricular ejection fraction. However, with a hole in the septum, some of that blood gets forced into the right ventricle, which can cause a pansystolic heart murmur and enlarge the right ventricle over time, and it can also provide back pressure to the lungs, which results in pulmonary hypertension. And so this all results in a reduction of the left ventricular ejection fraction and overall poor heart function. But peptides, they have been shown to work through several mechanisms to actually repair the heart from this damage, and not just in babies who have a higher degree of pluripotent cells. This is actually something which has been shown also after ischemic insults, such as a heart attack. These peptides work by reducing oxidative stress, specifically in heart tissues, which can limit further damage, and stimulating cellular repair mechanisms, leading to the regeneration of damaged myocardial cells. They also enhance cardiac function after ischemic events by improving blood flow and oxygen supply to the heart muscle. I will cover the specific benefits and detailed mechanisms of how these peptides work after sharing Emily's story. In a small village in Russia, there lived a woman named Emily. She was known for her unwavering resilience and kind heart, traits that had helped her navigate through the many challenges life had thrown her way. But nothing could have prepared her for the heartbreak she would experience when she was told that her first pregnancy would not result in a happy family she had always dreamed of. Emily's first child was born still, before it had even begun, due to severe heart defects. The doctors explained that her baby had a congenital heart condition so severe that survival had never been an option. The news shattered her, leaving her in a fog of grief and despair. However, Emily was not one to give up easily. After mourning her loss, she resolved to try again, determined to bring a healthy child into the world. Months passed, and eventually, Emily found herself pregnant once more. The early weeks were a blend of hope and fear as she wrestled with the possibility of another heartbreak. Her anxiety grew as she approached the 21-week mark, the time when a detailed ultrasound would reveal the condition of her baby's heart. The day of the ultrasound arrived, and Emily, her husband, and her mother-in-law all waited nervously as the technician performed the scan. The room was silent as the technician worked, her eyes fixed on the monitor. The tension in the air was palpable. Then the technician turned to Emily with a look of concern. The technician noticed something unusual and quickly fetched the doctor. The doctor entered the room, looked at the ultrasound images, and then turned to Emily with a serious expression. At this stage, there appears to be a ventricular septal defect of significant size, the doctor explained. While it's too early to fully assess the impact, larger defects like this can sometimes lead to complications. We'll need to monitor this closely, and depending on how things develop, surgery might be necessary after birth. Emily's heart sank. The thought of losing another child, of enduring that pain again, was unbearable. She nodded numbly as the doctor spoke, struggling to find words. Determined not to face another devastating loss, Emily sought alternative treatments. She discovered a doctor who was well-versed in non-traditional therapies, including peptides, a treatment not commonly used or accepted during pregnancy, despite having substantial evidence supporting its safety and benefits. This new doctor recommended a specific peptide protocol, and Emily decided to give it a try. Peptides, often labeled as contraindicated during pregnancy, have shown remarkable benefits in numerous studies. They have demonstrated effectiveness in improving conditions such as preeclampsia, miscarriage, and other pregnancy complications. They've been shown to enhance immunogram and coagulation parameters, reduce childbirth complications, increase spontaneous labor, and decrease labor weakness. Some studies even reported a significant reduction in fetal asphyxia. However, the specific peptides recommended by this new doctor were those showing promise in regenerating myocardial tissue. Emily knew this was far from a guaranteed solution, but she was willing to try anything to save her baby. After consulting with her husband and family, she started the peptide protocol at 21 weeks. The weeks that followed were filled with hope and uncertainty. Emily prayed that the treatments would work and that her baby's heart would heal. She attended regular checkups, each time holding her breath as the doctors examined the progress. For the first few weeks, there was little change, and Emily's heart ached with worry, but she refused to give up hope. Then, at 32 weeks, a miracle happened. During a routine ultrasound, the technician's expression changed from one of concern to surprise. She called the doctor into the room, and together they examined the screen. "This is incredible," the doctor said, turning to Emily with a smile. "The defect is completely healed. Your baby's heart appears completely normal." Emily couldn't believe what she was hearing. The hole in her baby's heart, which had threatened to end her pregnancy in tragedy, was gone. The doctors were astounded. They had never seen anything like it, but the proof was right in front of their eyes. These peptides, it seemed, had worked a miracle. The remaining weeks of Emily's pregnancy were filled with joy and anticipation. When the day finally arrived, she gave birth to a healthy baby girl. The baby's heart was strong, and she showed no signs of the defect that had once threatened her life. Emily held her daughter close, tears streaming down her face, overwhelmed with gratitude. This is a true testament to the power of peptides and their ability to not only halt the progression of heart damage, but to reverse it entirely. This was not just a temporary fix or band-aid solution, but rather a true cardiac regeneration. It was a breakthrough that promised to change the landscape of cardiology, offering hope where there had been none. If the story were to spread through the medical community and mainstream media, that is. But the truth is almost nobody knows about it. Even if they did, it would go against conventional wisdom, which has long held that regenerating myocardial tissue is extremely difficult and limited. However, just because most people think it's not possible, does not mean it isn't. They simply haven't seen the data we have access to. A handful of peptides have proven their ability to regenerate myocardial cells, even those that have died from ischemic reperfusion injuries, such as those caused by heart attacks. This ability isn't limited to just one peptide, nor is it exclusive to unborn children, who have more pluripotent cells and a higher healing capacity. Emily's story only scratches the surface. Imagine reducing your heart rate by 10 to 15 beats per minute and improving your VO2 max if you're an athlete. Consider having fewer angina attacks, reducing pain in your heart region, alleviating weakness, dizziness, headaches, tinnitus, and palpitations. All of these outcomes are within reach thanks to peptides. But how do they work? As the world's leading expert in peptide science, my obsession has been in studying the detailed mechanisms to uncover the secrets behind the power of peptides. They may sound too good to be true, but once you dive into the mechanisms, you'll find that the data supports the outcomes seen in both animal and human trials. Peptides regenerate the heart by multiple mechanisms. First, upregulating actin, a protein involved in cell migration, wound healing, and tissue repair. Tubulin, a microtubule protein, helps maintain cell structure, while vimentin, a filament protein found in fibroblasts, supports tissue integrity. Lamin A and lamin C improve nuclear structural support, help maintain chromatin structure and repair DNA, which enhances gene accessibility and transcription. When these factors are upregulated simultaneously, myocardial tissue regeneration is significantly improved. Take Sarah, one of our clients, as an example. Using these peptide strategies, we were able to enhance her left ventricular ejection fraction from 40% to 68% in just 3 months. This remarkable improvement illustrates the transformative potential of peptide therapy in cardiac care. The science behind these peptides is not just theoretical, but backed up by animal and human trials, showing tangible results. The breakthrough peptide treatments are making what once seemed impossible a reality. Emily's story and Sarah's dramatic recovery showcase just how far we've come in cardiac regeneration, and offer a glimpse into heart health that is possible today with the right knowledge, and is one of the benefits of our molecular bioenhancement coaching. This has been Brenden Henry, the world's leading expert in peptide science, who created the most comprehensive peptide course on the entire planet, covering 69 peptides and backed by over 300 scientific studies. This over 3-hour video course is neatly organized into sections for healing and optimizing each organ beyond its natural capacity for your age, whether you're looking to improve your health or enhance your performance. It includes quick reference guides, protocols, cheat sheets, and bonus modules showing you how to take your anti-aging and longevity or physical performance enhancement goals to the limit with highly synergistic peptide supplement and strategy combinations so that you can get an advantage over others who have no clue about this information. Just visit the link in the description to learn more.